Welcome to Trouble Afoot Live. This is a community of people living with CHARCOT FOOT, caregivers, family members, and advocates who come together to share experiences, encouragement, and hope. Each week, our discussion panel has a conversation starter ready, but the most important voice in tonight's conversation just might be yours. If you have a question, a concern, or simply want to share your experience, there's a couple ways to talk with us. First, you can simply type to us, just like in any common Facebook page. We'll try to post your message here on the live show and respond. Or scan the QR code and join us live. We'd love to see you face to face, answer your questions, hear your story, and learn from your experiences. Now, while we're not doctors and nothing shared here should replace the advice of your healthcare team, we are people who have walked a similar path. Together, we hope to encourage one another, share what we've learned, and remind every CHARCOT warrior that you're not alone. Welcome to the Trouble Afoot family. Let's get started. Good evening, everybody. Hey, thanks for joining us tonight. The Trouble Afoot podcast. I believe it's episode 88. So double eights tonight. Eights are wild. If you want to message us, you can get on the chat, type us a little message, and we'll get your message on here, or get on with QR code and get on live face to face with us. Okay. If you do chat with us, or even if you get on live with us for the first time, if it's your first time, let us know where you're from. I want to know what city so you can get on the map. And here's a picture of the map just so you know. That's the Trouble Afoot family footprint. Everybody that participates and helps out with the podcast on the episode, or helps out even just by saying hi to us, gets a star on their city. But now let's get to the real stars tonight. Let's get to our panel. There's our panel. It's an abbreviated panel. We got a couple people coming on late, hopefully. But hey, everybody, welcome. In the upper, let me introduce everybody in the upper left-hand corner. Always our first introduction, so I can tell you his little story, is Stephen from Satellite Beach, Florida. Welcome, Steve.
Thank you.
Stephen, of course, was originally told he probably had CHARCOT foot, and he went to Dr. Google, looked at everything and got scared to death, and got on the Facebook pages, and that's where I found him, because no one seemed to be talking to him, and he was scared, and he needed a friendly voice, and so we got Stephen all calmed down. Found out Stephen was a guy that cares about people, great sense of empathy, and then I found out that now he doesn't have CHARCOT foot, so there goes the empathy out the window for you, Stephen. We don't have for our empathy for you anyway. Now, anyway, Stephen does not have CHARCOT foot. Lucky man. But Stephen spent a career as a patient advocate at a major Orlando hospital, and very valuable to have on our panel to answer your questions if you have any questions, about, especially anything to do with hospital stays. Like I said before, if you don't like the green Jello, Stephen can tell you don't have to get the green Jello. You can get the orange Jello, right?
Yes, absolutely.
Could they ever do anything about the diabetic diet? Because they don't really offer you a lot on that diet.
Bring
They don't give you a
bring
lot.
your own food in.
Yeah, Can I take a cheeseburger? Well, you can have the patty and maybe one piece of cheese, and that's all you get for your entire meal. Oh, all right, great. Thanks a lot. So welcome, Stephen. Thanks for being here.
Thank you.
Next to Stephen is Nia, whose camera is working fine so far this week, until it gets dark there in Wales. Nia is from Wales. She is our UK correspondent for the Trouble Afoot show.
Hey.
And welcome, Nia.
Thank you.
Oh, I forgot. I have to put your little QR code up here, don't I? We'll put this up whenever I remember when we talk to Nia. This is Nia's group that she just formed a few weeks ago in the UK, and it's the fastest growing support group for CHARCOT foot in the world.
Absolutely.
Ever.
Hey, prove me wrong. if you can prove me wrong, I'll take that little. I'll take that off of there because it's not false advertising until it's false, right?
Yeah.
Right.
So click the QR code and you can join Nia's group. It's that simple. That takes you right there, and then you'll be a part of her discussions. And Nia invites everyone, even from the United States, because she loves us. And like I say, we all have feet, and as long as we either if she does an episode in Welsh, she can translate our English just somehow with a translator if she has to. I'm sure she can find a way. That way, that's the same thing with me. If I get someone that speaks to me in Welsh, I can translate it back to English. So don't worry about the distance across the pond. So I hope everything's going well with the Facebook group. A lot of comments we noticed.
Well, we're getting new followers every day, and we had a great discussion today on the page about how we're, how and where the clinicians and the healthcare that everybody was being provided with in the UK, and that was very, very enlightening, both good and bad.
I didn't recognize any of those cities though. They all
What?
ended in the Shire,
London?
Londonshire. Yeah, that's it, Londonshire.
Londonshire, yeah.
Londonshire. So anyway, hey, look at that. We got the. Oh, I thought we already had a message over there. Oh, that's just because of your thing going on there. Technology. I'm learning something new every day with this. So I'm gonna have to take your QR code off of there, Nia. Sorry, because otherwise we can't see Woody down in the lower right-hand corner.
Lower right-hand corner.
Welcome, Woody.
Hello. How are y'all?
Last time, our returning champion, Jason. He goes by Woody, and Jason, or Woody, or whatever you want to call him. Whatever you call him, he's been called worse, so it's okay.
Today.
Today, yeah. He is manning the chat line. So if you have a chat message that you want to put on instead of getting on live with us or a question, he's the one responsible for posting your question on the screen, and so that way you don't get upset with me if it doesn't get posted. But I'll try and help. If it gets crazy, I'll help you. But yeah, he'll take it. He said. But we're on not just Facebook Live; we're also on YouTube Live, and we're working on getting on TikTok Live. And so once that all gets more and more popular, Woody's job is not going to be very much fun. So our topic, unless someone has, if anyone has questions, feel free to ask, and your questions will come first. Okay. Let me see if now someone's got a message here on Facebook. Oh, just got a message from Martha's not going to be able to make it. Oh, too bad.
Hope all's okay.
Yeah, I'm going to type that, so let me do that. Hope all is well. And then we'll come back here. Okay, there we go. Our topic. Again, your questions will come first, but most of your questions will probably evolve around the topic of how to survive with this thing called Charcot foot. Tips and tricks on how to survive. And there's really no right and wrong answers to a lot of things that go on with this. And believe me, we may not have the answer. We're just a bunch of people that either were diagnosed with Charcot foot, like Stephen was diagnosed, or we are people that are Charcot warriors right now. And so we're just here living our experiences. Let me grab to where my questions were. I had a few people that asked me to post a couple questions because they weren't going to be able to be on. And they said that they'll watch the rebroadcast if there's any answers. And one of them very interesting that we all can answer. I know that Woody for sure and Stephen understand this because we're all about advocating. But this question from let's see, where's she from? Here we go. I post it on there. From Kathy in Wichita. Her doctor said that the only way she'll ever be happy is to get her foot amputated. And then she saw a guy on Facebook that said that reconstructive surgery to fix her foot that only works about 40% of the time. Is this true? What kind of answers you got for that, guys?
Well, from my point of view, sorry to cut across you there. I'll forget. It's my
You're
age.
one of the guys.
Called menopause. Called menopause. From my point of view, I'm under a great team of clinicians in London, Shire, Wayne, and my my doctor who leads the field in Charcot, luckily throughout Europe, and started advocating for limb for protecting limbs rather than
Limb salvage.
that limb salvage. That's the one. Thank you. And he's a big advocate in, possibly treating Charcot conservatively rather than going straight in, for the amputation. And his priority is limb salvage wherever he can. Him and his whole team. That's from the UK. That I can only talk about my experiences in the UK, but and he's absolutely adamant as an absolute professor of of Charcot foot and the experience that he's got, that limb salvage is possible in a lot of cases, on his behalf. So in the UK, and that's for London. I don't know about the rest of the UK, obviously, but it's amputation is not always the answer. Is what he says.
Guys, anything to add to what the doctor said about the only way that she'll ever be happy is to get her foot amputated?
And that's absurd. It's time for a second opinion.
Yeah.
Exactly. That's exactly what I wanted to hear. You have to advocate for yourself a lot of the times.
And you can ask him directly, would you be insulted if I got a second opinion? And in my own humble opinion, not that it's worth a dime, then if you're insulted by a second opinion, then we're not for each other, because you're not better than anybody else. And then maybe you have something that you don't know and you don't want the other one to know it and make you look stupid. So it's definitely time for a second opinion.
Right.
Yeah.
Definitely. That's so good.
And there were countless doctors that were the same opinion for me, right? Luckily, I found the right doctor that's helped me save my foot thus far. But I do believe that at some point in time in the future, it could come down to that's the only thing that's going to work. But for now,
Right.
I'm very happy with my foot.
Right. 1 second. Hi, Vicky. Vicky, we know you're from Minnesota. Vicky's been on before. Vicky just says hi, but also Sandy, we'll be with you in 1 second, okay? And Woody's story, just so you know, Woody had his amputation scheduled. I mean, it was scheduled, and this
the next
doctor
day.
swooped in the next day, and this doctor swooped
Wow.
in, took his case, and now Woody is doing well. Okay, he had the Achilles lengthening, and had a crow boot for quite some time, and it's like it's amazing, just to get. And Woody didn't even go for the second opinion. I mean, he didn't even necessarily ask this doctor. This doctor found out from a colleague about Woody's case. Amazing, right. Amazing stroke of luck. So, yeah, let's get Sandy's question on here real quick. So, hey, Sandy. Oh, hey, there's Dawn. What did you do that?
Hi.
Hey.
Hey, just
Hey, Dawn.
a second. Let me get you set up here, Dawn, real quick. Well, better late than never, Dawn. Thank you for messaging me and let me know.
Thanks.
Happy to have you here.
It's just one of those days.
Well, might be raining here soon. I might be stuck in a storm, so you guys might all have to take over for a few minutes if I have to run inside.
Oh yeah, you made it outside. Good.
Oh yeah. Let's see. If I can, I will. So let's see here. Panel. Okay. Now, Dawn, you're all set. This is. We already had one question from a listener or a viewer that I had talked to that couldn't make it on tonight. But Sandy just sent this question in. Newly diagnosed. Okay. They told her nicely to be non-weight bearing. Excellent. I'm so glad they told you that. It's her first visit to the podiatrist about Charcot foot. What should she be asking her doctor? Great question. Anybody? You guys are newer than me and Dawn. So what would you?
Well, you know, in hindsight, the first question that I would ask my doctor is to make sure that they're well educated. They're all well educated, but well versed in charcoal itself, right?
Right.
Not just every podiatrist is qualified to handle a case of charcoal foot, for sure. And if that's not something that they're uh, comfortable working with, then I would find another doctor that specializes in it without a doubt.
Well, that's key, is to get someone that specializes it. I mean, they have many podiatrists, but they might not. I mean, my podiatrist, when I asked him to get a second opinion, he goes, I welcome it. I could learn something from it. So right there, he's not a god. So
Yep.
he's okay with it.
Right. Right. Yeah, my podiatrist, he knew about it, but he said it's sort of still out of his lane. So that's why he referred me. So
That's not the best for him. One thing I would definitely do, and one thing I've learned when I see the physicians or the providers, it's like I'll ask them very politely, is it okay if I record this visit? Because I'll forget 3 lines of it, and they might be absolutely huge information that I'm not remembering and keeping in. But I would definitely get, what are the signs, symptoms to watch for? Make sure you wash your feet very good. You dry between the toes. The routine stuff that we all know from the history of doing it, that a newcomer would not know to watch for.
Right. And I wonder, Sandy, we don't know your history about if you have diabetes, if you've had foot troubles in the past, if you've had ulcers, if you had amputations of your toes or anything like that. But do you moisturize? So many things are going to become more and more important because your feet are going to become, because of the increased blood flow and everything that is associated with Charcot foot. It affects your skin too. It weakens your skin. So, they're excellent. A second opinion.
And that's great. You have a second opinion, but just take it one step further and just make sure that they fully understand Charcot foot. Even an orthopedic surgeon, may not be familiar enough with Charcot foot to adequately treat it.
How many cases a year would you say you've seen of this? And if they're in one handful, no disrespect to them, but if you say how many ankles have you fixed from some kind of trauma as a podiatrist, how many ankles? Oh God, I've done 200 a year. Then you have better idea.
Right, and Sandy, of course, too. Where is your Charcot? Where's your Charcot foot? Where are the problems? Is it midfoot, ankle? Talus bone? Is it? Do you have Charcot? What's it? Charcot anthropathy? I can't pronounce the word, but it's also called Charcot ankle, not just Charcot foot. Mine affected my midfoot more than my ankle, but a little bit into my ankle. That's why the shoes I just got from Alan are high tops, because it affected my ankle a bit. So we're not pulling any punches. We're being safe.
Yeah.
Give me the support in the ankle.
All right, Wayne, question to you there. With you having it, and that's something I learned. I didn't know you could get it in the ankle. Would an MRI cover that for the ankle to rule out for Charcot?
Sure. From what I understand, the MRI covers your entire ankle, foot, because you're going in that for the diagnosis of Charcot foot, which, again, Charcot foot, if you look it up, it's called Charcot ankle also. So, but it's not like Charcot knee. Okay, so it doesn't go up to the knee, but it's ankle issues. Okay. Dawn, did you have any issues with your knee? Ankle, I mean, your knee.
Me?
Yes.
No, I have no problems with my ankle.
Good.
But I would also suggest that they ask, what tests should I expect? And what do those tests tell you? What are you looking for on those tests? It's just something else I thought of. And maybe it might be too early to ask, but, what to expect, or, explain Charcot foot a little deeper, because there's not too much literature out there about it. So it's,
yeah, I mean, and if you look it up yourself, Sandy, it's scary. It's ridiculously scary if you go to Google. I mean, which you probably already have, but come on, I just assumed my foot was going to look like those feet with the entire reconstruction with the entire erector set in my foot, and walking on my ankle, and amputation and blah blah blah. If you caught it early enough, which maybe it sounds like they caught it pretty early with you because you don't have a lot of information, and you're just now going to the podiatrist and they told you to be non-weight bearing. I think they're trying to maybe avoid the rocker bottom, and maybe there's not as much collapse yet. Let's hope. Fingers crossed for you.
Oh, this is great.
Yeah, that's very good. All right,
Yeah.
Sandy, you're teaching us. If you know, good for you. That's really good.
You're in good hands.
Yes, so maybe you do have someone that's that knows what they're talking about. Hey, first of all, I don't know what city you're from in Ohio. If you could just mark that down, and so Woody can plop that on the screen, so then I can put you on that map with the city, because I'm just not going to put one big star in Ohio. We want your city. But other than that, that's not the most important thing, other than the information you're getting tonight. So hopefully that answers a lot of your questions. And
Great question.
don't be afraid. Don't be afraid of the crow boot. That's for sure. Don't be afraid of the crow. It's helped so many people. People hate it because it's big, fat, and ugly. Don't be afraid of it, especially when you're not fully diagnosed. You don't know exactly where all the collapse is. Sylvania, outside Toledo. They make light bulbs there, maybe. I don't know. Hey, that's my guess. Well, watch. She's going to say yes.
You're right. Yeah.
She's going to say, yes, we do have a light bulb over here. But that's good.
My doctor's not too far away, just an hour, and he's a specialist in near Ann Arbor.
Oh.
So, just a thought, not too far
So
from
if you're
Toledo.
not happy, yeah. So Dawn knows somebody if you need some help, possibly. Yeah.
Yeah, you need a third opinion.
Good deal. All right, Sandy, thank you for that. And back to saying hi to Vicky. Vicky, thanks for coming on. We haven't heard from you for a few weeks. And Vicky just went down and got fit for shoes from Alan also. And I'm gonna do this because let me get the right thing on here. I'll just show you a picture of my shoes. Let me find where I put my picture of my shoes, so you can see that I don't think any. Oh, my voice is on. There's my shoes. Okay, they're not. They sort of look like what are those things? Those clogs that you wear, but they almost look like a crow boot at the toes there, because I have to have enough room in the toe box for the way my toes are all curled up. And the picture of the shoe on the right, my that's where my three toes, my big toe will be on the left of that foot, and my first three toes there are amputated, but my little toe and my second toe for my little toe is curled up and over the second toe, because it's changed since I've used it for doing everything these past few years. And it's really up. I have a real tall foot right there. So Alan had to make that super, super thick to accommodate that. And then on my and then also on that same foot is where the ulcer is healing. So he had to make the bottom of the foot super, super thick to accommodate for a big indentation down in the bottom of the shoe. So I'm non-weight bearing on that sore. So that's, and then my Charcot foot is the foot on the left. Okay, let me get back to our panel. There they are, beautiful black patent leather shoes. Super comfortable. My goodness, I can't feel a lot in my feet, but I'm walking and it's super comfortable. And but I have to check them I only wear them a couple hours a day right now, because you have to check to see if there's any sores or anything that can form. So, there we go.
Stephen, that was called a nuclear CT, right?
Yeah, I'm looking it up now.
That's what I was trying to find. I couldn't find any of that today for that nuclear medicine test. So go ahead, Nia. What was that?
I just would like to know.
Uh-oh.
No.
We're not hearing you, Nia.
Oh, no.
Oh, you're back.
Better.
I wanted to know what.
Did anybody get all that?
No, the first part.
Oh, crap. And it was probably an important question.
Yeah, it was. Yeah.
Well, see, we hear a little bit of you.
Right. Can you hear me now?
Yeah.
Okay. What we wearing for?
What was she wearing before?
What was I? Oh, what shoes was I wearing before?
Oh,
Oh, gotcha. Okay. See, we could piece it all together. I actually had some orthotic shoes that were made for me for my Charcot foot where I had a rocker bottom before, and those things were just wearing thin, just horrible. I wore them down, but I was wearing a post surgical it's called a wedge shoe where you're basically walking on your heel, and that way I wasn't putting any pressure on my front toes to try and keep off of that sore, but that sore was gravitating a little more back towards the center of my foot, so I was putting some pressure even on that wedge shoe. It's not a shoe that you wear. You're supposed to be wearing for a long time, the post surgical shoe, but it's the only thing that could keep me off of that because my other orthotic shoe didn't fit anymore because of the way those toes curled, and I could only get shoes once a year here.
Right.
So that's what I was wearing, and so it was okay, but I wasn't really going out with much, very often. And I would wear that wedge shoe out if I was going to the doctor or if we go out to dinner or something. But it's not something you're supposed to be wearing.
Or anything.
Did you ask about a crow boot?
No boot, no crow boot or.
No, I have a crow boot for my Charcot foot. That was to heal the ulcer from my rocker bottom, but that's all healed up now, so I don't wear the crow.
Thank you.
And Sandy wants to message John. I don't know if you saw that.
yes, of course. I'd be happy to help.
She doesn't, but
the nuclear med test, it's called nuclear medicine white blood cell scan. And it's a 2-day part test. They draw like a big vial of blood from you, take it away, spit it down, then they come back and inject the white blood cells of whatever back into you and some medicine, and then an hour later they scan your foot.
Yeah.
Gotcha.
And there's also a blood test your doctor can order to tell if you have inflammation within.
Everything I could find said it was a bone scan, was the only nuclear scan where it's like a MRI where they put the contrast dye or something in, and I already knew about that. But Dawn, just so you know, Sandy doesn't have your last name because I'm keeping last names out of this if you want, and that's what I'm trying to do since we're on YouTube now. So you may want to message her.
I think I can, find her on the sites.
Right, and she's probably, if you just search her name on Messenger, it'll probably pop in because she's on the site. So,
the name of the test, it's called Nuclear Medicine White Blood Cell Scan.
Okay, good. I'm going to throw another question on here from another viewer that got on. Again, this is another gentleman says he wasn't going to be on tonight, so I thought we'd throw his question on. And this is Steve from Nashville. He saw the part of the show last week, and he saw that we were showing different mobility devices, but then he said he got cut off. He can't afford to go out and well, it doesn't say but he can't afford to go buy a knee scooter or any of the fancy stuff. So what he has to suffer with crutches. Don't always have to buy them.
Check your thrift stores. Check with churches. Check with maybe someone at social services within the hospital. Maybe someone came back and donated one. Many different options.
Right. Yeah, Dawn brought that up a little briefly last week about that. And we've got something called the Caring Center here where people donate things, and there's always a way. And when I got my first knee scooter a good 10 years ago, I asked my doctor if he could prescribe it, and he said, I don't think they do that. I said, why don't you try? He did, and they did.
Yeah.
So I got it for $10 a month, like that was what my prescriptions were back then. So ask about prescriptions. Ask, maybe there's some places that don't, like Steven said, talk to churches, talk to um, different places that donate things like that. There's so many people out there that are, there's a lot of help out there if you ask for it. But as we found out already, you have to advocate for yourself. You have to find that help. So that's a good question, Steve. Nashville, thank
And
you.
in
Good job.
the States, you can dial 211 to see if they can give you any other options to do. Like 411 for a number. I don't know. I don't think it's just in Florida. I'm pretty sure it's nationwide. Just 211. Like, I need help to pay my electric bill this month, whatever. And they'll be able to guide you in different ways of aspects to get assistance.
Very interesting. It's like over in the UK, 999.
I think they wouldn't appreciate that. But what I was going to ask, all the help available. Can everyone hear me?
Yes.
Yeah, I'm okay. It's not always that easy to seek help because obviously here in the UK we're a lot more policy with regards to CHARCOT, and it's possible. I've advocated for myself because I've had to, but it's been so difficult to try to source mobility aid, some kind of financial help with things. It's been so difficult to get any kind of help at all. So you're very lucky if you've got access to those kinds of help. I'm only now, after pushing and pushing and pushing, getting some kind of help. And that's not much.
Yeah, but your knowledge you've learned now might help the person you meet in a month from now that is going through the same thing and maybe is not as strong as you. And you could make a difference there, and then the whole trail can follow.
But it's so overwhelming. You're having to deal with the diagnosis, deal with the pain, deal with having to manage your CHARCOT, as well as trying to find lifelines. It is overwhelming. It's not easy, but don't feel that you're on your own.
Being sick is not for the weak.
Right. I've got one more question that a viewer. Now this person is called anonymous here. They're not anonymous to me. I've talked to them. We've actually spoken. I talk to a lot of people throughout the week, even on the studio, but I don't record all the time. I just like to talk to people, get to know people, and direct them to the right place if they need some help. But this was interesting. They just didn't want their name shown. From Skokie, from Illinois. That's how I got their name, because they're from Illinois. But their doctor says that all he needs are better shoes, and the disease can be controlled. But then this person goes on to Facebook, and it sounds like that's not how it is on Facebook pages. Who's right? The podiatrist? He has to be right because he went to school for this.
Absolutely not.
Right.
Yeah, absolutely not. You're acting like they're not human. They're just not educated in that field. And again, I would go back to how many of you treated in a year, and then go there. And then you can even probably find most of that out on Google about Dr. Jones. You can see how many times with his reviews, his people, and their knowledge. You can just do your research, please. Do your research. This is your body. You're the most affected by it.
Right. And I've got some other questions that I tried to get some things lined up for us so we can discuss some of these things. My dogs are all over me. I wonder if that storm's coming in. Ooh. You guys are staying out here. If I'm staying out here, you're staying out here.
Okay. Yeah.
Dawn brought up some good, very interesting point about. Everything just sort of froze up on me here. I don't know if you're still hearing me, but everything froze up.
We hear you, but you are frozen and your mouth is open.
I just finally heard Steven say something, but
it's not flattering.
Yeah, no.
I can see the picture. That's nice.
Oh, wait a minute. I'll take a picture. Boom, there we
go. There's been worse pictures probably. So we try and go off the screen and come back.
There you go. You're good now. You're good.
Now is it flattering? Okay.
Of course.
Anyway, Dawn talked about getting a therapist. That was a great suggestion. So that thought of thinking of some different questions on the mental side. Now, none of us are therapists, of course, but a question that, of course, now the question it froze up. My mouth is open again, frozen up. I'm getting people Facebooking like crazy. That's the problem. Hey, hi everybody.
You're back.
Okay, let's get there we go. What helps you deal with the boredom or long periods of sitting around? Okay, because now, granted, we don't all just sit around, but when we were non-weight bearing, okay, so we're talking about people that are either freshly diagnosed as being non-weight bearing or freshly out of surgery, sitting around. You know what helped you guys deal with the boredom of sitting around, or to stop thinking about Charcot Foot all day?
Can you change your scenery maybe? Sit around at the mall and people watch. You could be non-weight bearing. You could sit at the zoo and watch animals and be non-weight bearing. I'm just thinking change of scenery might help a little bit to be out of the house.
Think outside the box.
Yes.
I think that those are great. Those are great ideas. I mean, and I can people watch all day long.
I know, me too. Go to the airport.
Yeah. See, to me, we don't have a zoo, but we have a mall, and it's like a zoo.
Yeah.
So it's probably Netflix. That's the biggest zoo there is right now.
Yeah.
I got real tired of TV though. It was really it was.
They have activity books for people who specifically for injured legs. You know, like it says like your whatever leg color activity book, and it has word search in there, color, you know,
right.
Whatever.
My mom was. She really got into the adult coloring books with the pencils and everything, and boy, some of those were really challenging. Yeah. I probably couldn't stay inside the lines, that's for sure. But
neither.
She did a good job. But
it's soothing.
It's interesting. Another question very similar to this, but it's even on the really bad days, what gets you through? Because you know what? We all have bad days, but anyone that's been diagnosed with this has had some really bad days.
My partner, my family, my friends.
Yeah.
It just seems like they know.
Yeah, a good frisbee. Yeah, right, dogs. Right.
True.
There, Sandy.
There you go, Sandy.
Paint. Thank you, Sandy. Thank you.
She's my kind
You're
of
really
person.
going to get a star on the map. Yeah. I mean, it's just. The TV got old, and when things were really, really bad, if my wife was home, I had someone to talk to. But I was fortunate enough after maybe 6 or 7 months to find the Facebook groups,
right?
And had some people to talk to and people that had been there, and that's why we're here. Just to help everybody out.
I think.
Wayne, go ahead, Don.
I think it goes back to we have to learn how to ask for what we need, and ask a friend or ask a former colleague or ask a neighbor if they could, come over for a little bit or something like that. I think we have to ask, and it's really, really hard to do. Something I think I'm still learning to. I think I'm good at it, but I'm still learning to do.
You called your neighbor for that ride.
What?
You called your neighbor for the ride, and she was just waiting for you to call.
That's right. Yeah. So I think sometimes we have to ask. I'm really bored. I need some stimulation. Can you help in any way?
And Wayne, you had a great support system. You forgot your 2 doggies.
Well, that had a lot to do with the frisbee. When I talked about the frisbee. Well, when people ask about my support system, I had 3. It was the 2 dogs and my wife, and that was it. I mean, that's what really got me through. And now they're going in the house. because the wife is home and she let him in the house, and now I'm going to sit out in the storm all by myself. Fine. Goodbye, support system. Goodbye. There goes that support system. um, talking about asking for help from others. Interesting question. What's something you've had to accept that you can't or shouldn't do alone anymore?
Get on a ladder or a step stool.
Yeah.
Yep.
Mow the lawn.
There's a lot of
Woody, did you hear what he said?
Blasphemy, Stephen.
You know,
He
wound
loves
on
one line.
one foot, so I have to say more or less he wants me just in the boot. And
I
my
live
partner
to
won't
know,
let me do anything, so
Yeah, that's the ladders, step ladders. Don't even try it, guys. Don't step stools. Come on, be careful. Especially, you know, I thought, oh, I had neuropathy. I can handle it. No, because now your foot is collapsing, and you just don't want that. It's no. Don't even put those undue pressures on your foot. What about
and the
you, Nia?
balance.
Because Nia, you overdid it a little bit. You admitted to me you overdid it.
Yeah, I overdid it. I had a fresh pain that I hadn't had that didn't sit very well with me. It was underneath my foot. I have rocker foot, so I phoned the in London and said, "Look, this doesn't feel good. It feels warm. It wasn't red." Anyway, I whizzed down to London on Sunday evening, on Sunday night, and Monday morning I went to the hospital. Spent the day there yesterday, and had all the appropriate X-rays. Had the scans, and turns out it's not reactivated charcoal, but it's the tail end of the charcoal that I had. I've been putting too much weight on it with a boot. I always wear a boot. But there's too much kind of the movement within the bones. I've got a collapsed midfoot, and my arch is completely, and my metatarsals are calcifying. They all fractured, but they are calcifying, but not in the right place at all. They took a good look, temperature slightly higher, and they said, right, there's too much kind of give in your foot bone. So we're just gonna slap it all together and put it in a total contract cast. So that's,
Right.
but
Hey,
however,
Don. Oh,
I just had
go ahead.
after not traveling alone or doing anything alone since January, February, I managed to get on the bus from the hospital in London, in central London, on my own. Um, and that is massive. Might not be for anyone else, but it's huge for me who hasn't done anything alone. You're saying what you shouldn't do and what you definitely should push yourself out of that safe spot, because I'm in a very safe place now where I won't do anything unless my partner, which we will not name tonight, helps, or my friend. But I actually navigated my way around London on a bus to get to Euston, the main station, and got myself on the train and back to North Wales alone. So you should push yourself to do things on your own, because you can do it. You can do it.
Right, right. As long as you're not putting yourself in danger, right? Hey, Dawn, did you have a total contact cast ever?
no.
Okay, because Nia, you showed me yours, and it just looks like they put some sort of post-surgical shoe on there. You don't have a real boot surrounding that. Do they
I
tell you just to walk on it as much as you want?
I mean, I was in a boot, but
No,
now
around your cast.
I'm in a full cast. Yeah, yeah, yeah. They've
Well,
got
you're in a TCC, and those are not plaster. Those are not as they have
no,
some give
not
to them.
they're not plaster of Paris. It's like a fiberglass.
Oh, right. I know what they are. I've had them for years, but the boot they put over it is just a small little shoe. Did they tell you that you can walk unlimited on that now, or did they?
No, they've told me that if I want to kind of walk a little bit, to the bathroom, and that I use the boot. They've told me not to walk just on the cast, but they've given me like a slipper.
Well, it's right. It's just if you can show it, because I had a full boot on that had almost like the Crow boot, where it had 3 straps going across it, and it was over the total contact cast. And so if I get my TCC this week, I'll show you. But that's made to walk with it. But yours, I was afraid when I saw the picture that they were going to let you walk with it fully, and that scared me.
No, the whole point is that I've done too much weight bearing on it, and it's kind of aggravated my rocket foot, and it's warmed the temperatures again of my foot. I don't have any ulcers or anything like that. Also, interestingly, I don't know, I've changed my medication now, and that's actually made my blood pressure go really low. So just to add to everything else, I'm also really dizzy and keep falling over and keeling to the right.
Oh, you don't want that. That's not good.
No,
well, don't be taking the bus.
I've just tried to reverse my camera and just left the chat completely. So.
Oh, well, we can see it some other time. That's okay.
That's okay. Yeah. Okay.
Okay. Let's see here. We're about to doing things alone anymore.
Oh, there we go. I got it.
A surgical
see, that just
shoe.
looks like a post-surgical. Yeah, that's a post-surgical shoe. Yeah, and so I'm surprised. Well, at least
it's
that's hard. So that's
move. It's a walking cast with a surgical shoe.
That's a TCC. That's not a walking cast. Well, it's a walking cast. Yes. It's a total contact cast, but if you're supposed to walk on that, you're supposed to have a full boot.
I'm
really
not
almost like a cam.
I'm not supposed to be walking on it. I'm supposed to be.
Gotcha.
Off it completely.
It's even worse to try and walk on that cast because you're gonna slip and slide everywhere. So that's what that's for. So at least you can bear some weight on it. It's okay. But yeah, when I saw that, I'm like, that's not the best thing for you. But at least they're not telling you to walk that
Go
much.
me for reversing my camera and not leaving the chat.
Good job, yeah. And and your camera's still working, and
it's still here.
Look how sunny it is there.
I know.
Got that bright light on. Let's see. I had one other thing about. Is there anything now? This may not. Now, a lot of these questions may not really go towards a lot of us right now, but it's something that people that are watching might think about. And any of these questions we're bringing up, if you have something you want to answer to them next week or the week after, bring it up. These are not limited time questions, okay? They're forever. Is it anything that you guys are still trying to figure out that we might be able to help with, even us on the panel or anyone else out there? Because Dawn is diagnosed for 10 years. I'm over 3 years. Woody's had trouble for 10 years. But I'm sure there's some things I could probably think of that I haven't figured out, but I'm still hurting myself by doing. Anything? Well, then let's just think about this question, and we'll table that for another time. Unless you got something, Dawn. What can we help you with, Dawn? 10 years?
What am I still trying to figure out?
Is there anything that, I mean, obviously we don't have all the answers, but you're actually in pretty good shape right now, but let's hope it never.
Yeah. I am in great shape right now, but I have that cautionary thing in the back of my mind that's wondering when's the next thing going to happen? When's my next explosion? When am I going to be compromised again?
Well, that's interesting that you mentioned that. So after you were diagnosed, 10 years ago, did you flare up again since then, or was it only a one-time deal and now it's been a smooth 8 years or so? I mean,
my left foot, it healed. It's better. It's never gone back into an active Charcot status. So everything else along the way has been with my right foot. On and off. It's been better, and I've been back in a shoe, and then it's been really bad. And then I've had a Crow on for a year, and then I was allowed to wear a walking boot, like a cam boot, which cam means something assisted. It means something.
And
I
that's
forget.
the one that I didn't. That's the one I didn't mark down.
I
I
know
don't
this.
remember, but
I know this, but I'm
it's
drawing a blank.
Is it a lady?
But the cam, like like a black boot or a gray boot with the straps on, like you were saying, Wayne.
the thing that Nia should be wearing. Yeah.
So it's called.
I have been wearing one of those.
So I've been back and
Right.
forth
You have.
between a real active state and with going to the doctor every week for seriously compromised bones and wounds to just being a little hot and a little swollen. Most recently, I was in the crow boot, the big crow, for 3 years until I saw my last doctor, and right now I'm in shoes again.
Oh, wow.
Reason I asked you that was because my wife when we were at the doctor the last time mentioned something about, well, when is this going to hit him again? And I'm like, what? I mean, it's a good question, obviously, but she said that she heard a doctor somewhere along the line say every 5 years it's going to be back. I'm like, I've never heard the 5-year number. I've heard that it can activate again, or it can be in your other foot, and then once you have it, you've got it. But I've never heard the 5-year thing, so I thought maybe you.
Yeah, I don't think 5 years is accurate, but I do think if you do too much or you're walking on it without a proper shoe, you can revert back to it pretty quickly.
Right. Talking about how you couldn't remember what CAM stood for. Now, I didn't know if anyone Googled or not. I haven't, but you brought something up. Yeah, it's called controlled ankle motion. Duh.
There you go.
Thanks, Sandy. You're on the team, Sandy. Thank you. That's awesome. One thing that Dawn messaged me about was the acronyms. Since we've got about 8-10 minutes left here, all the acronyms. Why can't we just use our words? Okay. It's so interesting because we can sit and talk about these things and we sort of know what we're talking about. We might not have known exactly what CAM stood for, but we knew what it was. But we'll sit out here and rattle off AFO, Crow Boot. I got my X-Fix or my EF. I got a BKA, NWB, AK above the knee. PT. I got to go to PT. There's so many of these a lot of people don't know about. But let's run through them just so people, if they're listening and maybe they have that question they don't want to ask because they think it's a dumb question, but no such thing as a dumb question. Yeah, I mean, come on, guys. AFO. Ankle
what?
Foot.
Or
ankle foot orthotic.
Ankle foot
orthotic. Yeah, ankle foot orthotic, I believe. And then there's been a lot of people that try and debate me on what CROW stands for, but I knew it just because my last name's Walker, so I had this thing memorized day one. Charcot restraint, orthotic walker. Again, I thought I'd heard of a CROW boot over my prior 58 years of my life, or 56 years of my life before I was diagnosed. But I guess I never had, because it stands specifically for Charcot. It was made for Charcot foot. Not for Charcot Marie tooth, for Charcot foot. The way it offloads pressure points. So pretty interesting to know what it stands for. So when someone says it's a CROW walker, say, well, yeah, it's a CROW. And if someone says it's a CROW boot, it's not even a CROW boot. It's just a CROW. But CROW boot seems to be what we all call it, because then they think we're wearing a bird on our foot. But okay, we got our EF, which is our external fixator.
But what's an external fixator?
That's a great question. It's a external skeleton, basically, to hold you together after surgery, so they don't have to put a bunch of things inside of you to hold on. It looks like if you ever saw someone that broke their neck in a car accident, the big halo. It's what it looks like, but it's on your leg. And it's a scary, scary prospect. It's a scary looking machine. It just looks like you're a robot with those pins going through your bones and holding everything together. But It really wasn't that bad. Dawn, was it that bad?
No,
It really wasn't at all. They did a pain block, after surgery that they probably did for you too.
yeah,
And so you've got a few days there if they do the right pain block, and the one that uses steroids or whatever. That if they ask you about a pain block before surgery and they say, "Do you want the one with or without the steroids?" Just say you want the juice. You want the steroids because it lasts
But
longer.
you're diabetic, then you're diabetic. That throws your blood sugar up.
It's okay. I'd rather have my blood sugar thrown off when I'm in the hospital. They can control it. I don't want the pain, and it's something that's not narcotic. You know what I mean. I don't want to have to deal with the narcotics. But so you've got that pain block going on. So you think that this is going to hurt so bad when you come out of surgery. Yeah, I couldn't feel a thing. I was just looking at it, but with that, because those pins go through your skin, because you already have diabetes, because you already have neuropathy, you already have history of infection. You're already bad with infection, probably like me. You have to be real careful because those are holes in your skin going right to your bone. So you have to keep those pin sites clean. And a lot of doctors do not use the expensive. You know how the thing on your pick. We're going to get to that. There's no one pick. Yeah, on your Woody had a pick line, a pick. Don't use the word line because it's already in there. But
Yep.
he had a pick, and it's that little foam thing that covers where it goes into your skin or whatever. That keeps it sanitary. That's on a lot of external fixators too, but a lot of places don't use those because they're very expensive. So it's just a open wound going into your skin, and there's so many holes in your leg. How many holes are in your leg, Dawn, with the external fixator?
I could count
10,
my little
15, 10,
dots
16?
on my leg. I don't know.
Me too. I can see that too. So 16. I mean, there's one on each side, so it's in the multiples of 2. Plus, that goes through your foot too.
It doesn't
Holding
hurt
those
though.
things together.
It sounds really bad, but it's not.
It does. Yeah, we've had people so afraid, and that's not what I'd be afraid of.
No.
I'd be afraid of not keeping it clean. My wife every night cleaned those pin sites, and because you don't want the infection. I mean, same with all my incisions were just left wide open. They didn't bandage them all up. They were wide open, and she'd clean all the incisions and all the pin sites, and kept me nice and clean after my first week. Which you have to listen to my story for that to hear about that one.
Some of these things we talk about, like, I live alone, so I never had the luxury of having someone clean my pin sites every day or they came like once a week. A home nurse came. So sometime we should talk about differences between,
Yeah, definitely. And I can't imagine going through this living alone, Dawn. Unfortunately, a lot of home health care, they don't spend much time with you.
No.
Hopefully, you had a good nurses that came to your house. So you only had them cleaned like once a week?
That's correct.
Or did you reach down there and clean them yourself? See, I didn't want to have to reach down there and clean them myself. Because they're behind your leg and all that. But I have a question for you. How did you make sure you kept your leg cleaner than normal? Did you put a pillowcase over your external fixator?
I did not.
That's a great tip. That's a great trick, guys. Put a pillowcase over. You're not going to get dirt, dust, flies.
Scare anybody?
Okay, don't listen to my story. I'll tell you. You guys had to all listen to my story at least once, I hope. But in my incision, my first week home, I just sat outside because I love sitting outside, and I missed sitting outside. Flies got into my bandages, regular old house flies. And what happened when I got an infection? After 4 days, I had to go to the ER. They ambulanced me for 2 hours back to Chicago because they didn't want to touch it. They didn't know what it was. They wouldn't even unbandage it because they know nothing about CHARCOT Foot here. And I get there, they unbandage it, and what do flies leave? Little eggs. What do little fly eggs turn into?
Maggots.
Maggots. Yep. So my doctor told me You've got maggots out of the
Ew.
blue. I I'm never one to get sick to my stomach, and I'm telling him give me the Zofran, get that right now. And then he tells me, oh, it's they use maggots, medical maggots, to clean wounds. I'm like, well, why didn't you tell me that 5 minutes ago before you made me sick? And yeah, and they just plucked them out of there, and alcohol killed them. And how
Still,
disgusting!
it's good to have the choice whether you want them in there, isn't it, Wayne?
That's right. I did not have the choice of maggots or no maggots, and but maggots. Just so everybody knows, if you do have my little friends visit you, they only stick to dead tissue. They eat dead tissue. They do not burrow into your skin. So don't think the bad. That's what I thought. I'm thinking, zombie apocalypse maggots, and yeah, but they were just. I mean, you could hardly see them. They were tiny, but they were still there, and yeah, that was the most disgusting thing that I ever could think of. And that's why I had an infection. I thought they were going to have to go in and clean everything out, open everything up again, and they didn't have to. Luckily, antibiotics through my pick. Which what does PICC stand for?
Yeah, I'm gonna divert to you. A long ass line going into your arm.
Peripheral,
Peripheral.
intravenous,
Something catheter.
Yeah.
I don't know what the other C is, but yes,
Central.
Google it, baby. Maybe central. That's a good word. That's good. Um,
Yeah.
Cowabunga. That starts with a C. Uh, but it has the word catheter in it. So when people tell me to pick line, I'm like, catheter means line. But that's just being okay. We got a big phone in our face.
peripherally inserted
Ooh.
central catheter.
Oh well,
Take a
central,
pick.
peripheral. I tell you, that looks like it hurts. But Woody,
No, not at all.
I
no.
talked the entire time. I had 3 in the
You
last
know,
month.
putting it in is scary. It doesn't hurt. It's scary. Taking it out, they just grip it and rip it.
Oh gosh, no kidding. Yeah, it's almost well. At least you can't feel that like if you have a kidney stone.
Yeah.
I knew the one putting the pick line in me. 3 of them. I knew the nurses, so we just sat and bullshit and talked, and
My
Yep.
last
it went.
pick they put in, one guy did it. One guy alone did it. He came in with his own little ultrasound machine. Boom, boom, boom.
Yeah.
He was done. I mean, they
But
numb
they
you
will.
up.
Yeah,
It doesn't
we
hurt.
used to have everything.
They
Yeah.
put that line all the way right in right at your heart, right there too. And they put it too far, and then they have to pull it back.
The last one I
And
had, the last one I had, they put it in, and he thought that his line was 44 inches, and it was only 40, so he had to take it back out and do it again.
well, that's no fun to know they have to do it again, even though
Yeah.
it doesn't hurt. But
No.
I mean, they do. They numb you up really good. So I mean,
Yeah.
so a lot of this stuff doesn't hurt. It's just scary. But guys, we've already taken up. I've got a lot more questions, and we've got a lot more tips and tricks to share with everybody because we will deal with your questions too. Hopefully next week. Hopefully this thought made people think of more questions that they want to ask us next week. And plus, what we have here, PT, physical therapy. Uh, and I'd never heard of AKA, but that's obviously an above the knee amputation. But that was thrown out there a lot when I was looking up acronyms. But interesting, let's use our words, folks. But let's I guess we can see if anyone has any closing words. We're gonna start up with you again, Stephen.
Learn and advocate for yourself. Be knowledgeable and take care of you.
Yes, that's a big takeaway from tonight is advocate for yourself, I think. So, all right, Stephen, we're going to send you off here. We'll see you next week.
All right. Take care, guys.
Okay,
Thank
buddy.
you.
Bye.
Bye, guy. Nia, falling asleep from Wales. You look tired, my dear.
Oh no, I am tired, but I'm not falling asleep. I'm just resting my hand. From the UK, you might think that there's not much battle had, but there is, guys. Okay, Woody's put the the single point of access is the messaging, and reach out. You're not on your own. Again, back to advocate yourself.
Yes. And that's again that's the takeaway I want to have with people all the time. And you are not alone. Uh, and I hope people are going to learn that from your page too,
Thank you.
because I think you're building something strong there, and I think that's great. So,
Thank
Nia, thank you for being with us again from
Thank
Wales. We will see you next time, Nia.
Take care, guys.
Bye.
All right. Good night, dear. Well, we're gonna say goodbye to Dawn. Dawn's got her shirt on, but
Yeah.
she got mirrored. Wait, let me mirror your camera the right way. There we go. Yeah, look at those shirts, Woody. What do you think?
I like those. I like those. I wish I had
Woody's is on the way,
one.
and
Sweet.
we just have to get Nia one. And Nia's back there cursing at me in the backstage area right now. But don't tell Nia that there might be one on the way to her too.
Oh, really? Good.
That would be
she's got
great.
she's awake now. I can see her back there. She's awake now. She's going to lose sleep now. She's going to be waiting for 3 weeks for this thing, and it's not even on the way. just we don't know, Nia, do we? It's a secret. We're not going to tell you. But Dawn, we're here now to thank you for coming on. Sorry you had to be a little late, but you only missed one question. That's okay.
Okay. Same thing about advocating, and I just want to reiterate, it's okay to ask for help. It's people want to help. If you say, be great to have a dinner, or could you make a casserole that would last me 4 days, whatever, that would feed my family for 2 days or whatever. It's okay to ask for help. Just like the person typing in today, who I will reach out to, she's asking for help. And, we are people who can help, and we are happy to do it. That's why we are on here every week.
Yep. We're not here for the paycheck, I don't think.
No. I hadn't seen mine yet. But
No.
I'm sure it's coming.
Well, it's you're getting a shirt.
Yeah.
That's more than Nia gets, but oh, now Nia doesn't know. She's confused. So, all right, Dawn, thank you so much, dear. We will talk to you next week.
Bye, Dawn.
Say bye, Dawn. Bye, Reddy. All right, just us again, Woody. The chat wasn't too crazy tonight, so
It was good though.
It was very good.
There was enough going. It was great. Yeah.
Well, again, I feel like I dropped the ball not having questions ready, but now there's a lot of different questions that we all have ready, and to have 3 people want to ask questions because they couldn't make it, that was great. So those are people that are probably going to be viewing us from now on, and that's if you guys have a question and you can't make it on, reach out to one of us and tell us you want us to ask the question for you, and we'd be happy to ask the question for you. So, Woody, let me get here. We're getting ready to sign you up, but it's time for you to say your goodbyes. What do you got?
Advocate for sure. I love what Don just said about, ask people to help you. And me, number one, I am not a rule follower, right? But I am now. So do what they tell you to do, when they tell you to do it, how they tell you to do it, because it's nothing to mess around with.
Yeah, it's not a game anymore. I mean, I had toes amputated because I just wasn't following advice because of being diabetic, having diabetes. Well, this is much more severe than just having diabetes, and I think I've learned my lesson. So, all right,
Yep,
Woody, thank
sure.
you, my man. We will see you next
Thanks.
week, and maybe
right,
we'll
thanks,
get on
Wayne.
TikTok next week.
We will.
All right,
we're on it.
We'll talk to you soon, buddy. Thank you. All right,
All right.
bye.
Bye-bye.
All right, that just leaves me with everybody again. Thank you, everybody that watched. It was very informative. Hopefully, we helped out. And Sandy, thank you for asking the questions. And Alan, I don't know if I cannot get you on. I keep trying to push the buttons, and nothing was even trying to pull you on screen. I don't think you're there anymore. I don't see anything, but I know you tried. But I was trying to get you, and there was just nothing happening. So. All right, let me get to the right spot here. And everybody, we will talk to you next week, same time, same channels, YouTube Live, Facebook Live. Just search Trouble Afoot Podcast, and that will get you to the YouTube page or the Facebook page. I have to do something with Facebook, or else I have to renew something. So we'll try and get that all fixed for next week. And everybody have a great week. Thanks again for watching. Hey, maybe not tonight because it's getting late out there, but tomorrow, remember, get out there and do something nice for yourself because you're worth it.